Good morning, everyone. Thank you for joining us today. It's 9:50, so I think we've got everybody online that we're going to have online. For those of you who don't know, I am Ryan McKinster. I'm your Government Affairs Director here at the BIA. I have a few other people online. Andrea Smith, who's our Communications and Education Manager, and I believe Avery Scarapelli, who's our Executive Director, is online as well. I think a lot of you have been on these calls prior. To some extent, to this one, I'm just going to kind of go over the requirements and the protocols that are under the governor's new order that allows you to work. Basically, if you follow these guidelines and you qualify, which is fairly simple, you're allowed to go back to work and you're considered essential. You're not a separate person. You're not a separate type of business. You are an essential business and essential workers as long as you follow the protocol in this document. So just to give you an idea of the people that got on the last few minutes, I spoke to this a minute ago. The idea is here, go kind of a high view overview of what the requirements of the governor's order and the job site requirements are. I'm under the assumption that most of you have read it and reviewed it already, so we don't want to get too in depth. If you go to our site, which I'll reference a few times, BIA.clarkcounty.org/phase1, that has all this information there. Andrea's kept that up to date. It's a succinct page that's specifically about this stuff and not all the other stuff that we're working on. So if you go to that page, it will have this stuff there. Has links to some webinars that BIAW has done Saturday and yesterday regarding this issue. It's a little bit more in depth. So like I said, I'm going to keep it at a higher level, 30,000 foot view. Because those are a much better resource for some of the specifics, but I'll answer your questions today. Those are put on by Greg with the BIAW. He is the Executive Vice President. He's our Executive Officer. And he's been actually in the room for the stakeholder group. He's part of that group, as well as he works regularly with the governor's office answering some of the questions that people come up. So he's going to be a really good source, and those are a good source of some very specific particulars. But I'll try to give you an overview, and I'm more than welcome to answer the questions if I can. If I can't, I'll direct you probably to the appropriate resource, which is most likely BIAW. Before I start, are there any questions that you guys have now? Okay. So just to give you guys an idea, basically on last week on Friday, the governor basically said an addendum to his previous order that qualifies low risk construction projects as essential. So basically what low risk means is an existing project, which we can discuss in a bit after we get through this. I know there's questions there. And obviously there's some precepts that we will also talk about in the requirements and proposal itself. It kind of lends itself to describing what's low risk and what qualifies. So as long as you have those projects, you're able to go back to work now, fully functioning, as long as you follow the protocol immediately. I think most of you know that, but that's where we stand with this. The biggest issue with the protocol, or if you're low risk, is you have to maintain that social distancing of 6 feet at all times. There's not a lot of leeway on this. One of the examples that's being used by Greg in his presentation is if you have like appliances and you have to have 2 people next to each other lifting up the thing, most likely that's not going to work, right? You can't do that. So we're gonna have to look at how you guys want to deal with those things when you get to those points of your construction. But having said that, that is something they're working on for phase 2, which I will also answer questions about a little bit after we go over the top of this. So basically, there's a couple things. Basically, to start out, before you go back to work, you need to comply with these things, all of these, the signage, the plans in place, everything else like that. There's not a lot of leeway on this. I know it's really hard to comply with all these, but this is kind of considered a privilege right now, not a right to work. So we really need you guys to follow these things. The governor was very specific in his press conference and in subsequent conversations, I think, with Greg, that this is ours to run with, but if we make mistakes, it could be reversed. If we see a lot of non-compliance or other issues, the governor can and has said he will reverse this decision. Having said that, the bigger concern are probably local jurisdictions. If they feel you're not complying with this, there's nothing prohibiting them legally from writing a more restrictive restriction, emergency order or resolution underneath the governor's order. So we obviously want to be good neighbors and good community members, and we really want to follow these things because it doesn't only affect us on each of our projects, it affects all of our, our other colleagues in the industry if something goes wrong. So,
hey, Ryan,
yep,
this is
Karen.
a quick question around that. So how much, how much do we want to, and I hate using this word, but police ourselves about this and make sure that as builders that are trying to follow what you just said, do we want to police ourselves?
Yeah, Garen, I appreciate that question. To some extent, as a trade association, we don't. It's difficult for us to do that. I've had some people I've spoken with that had some concerns, and they luckily had the relationship with some of the other people they saw. They're like, for example, they were working in development on their 3 or 4 lots, and there's other people, and they walked over to them. Or I think one of them was an owner of a corporation, called the owner of the other and said, "Hey, you got some subs on your site that aren't doing this." I think right now it's kind of a, a friendly, hey, reach out to who you think is appropriate and let them know that they need to do it and remind them of kind of what I just said. I think that's where we're at right now. This is fairly new. I don't know where it would go after that. That's kind of the recommendation that BIW has given as well. Hopefully we can rely on our relationships as colleagues and industry members to push that forward. I know there has been concern, and I've gotten it from a few people, a very valid concern. There's a lot of people that are not members of our organization, and they, to some extent, haven't even been following the rules prior to this decision, and they aren't now. Not much we can do about that. I guess I would leave that up to each of you, how you want to deal with it. As an individual community member and a business and a colleague and industry member, how you want to deal with that. As an organization, I would say, to some extent, that's kind of what my answer is.
Thank you. I just look out my kitchen window and I'm looking at 5 homes being developed, and this morning I'm seeing maybe 25% compliance.
Yeah, that's obviously a concern because not only does it affect them, right? It affects all of us. This is not, even if it doesn't go as far as enforcement, public relations wise for our industry, we have a privilege that others are stuck at home that do not have. So we got to be very conscious of that. So I appreciate that. There's one other issue right now that does cause some confusion. If you were working previously to this week under the governor's order of essential, whatever your jurisdiction deemed that to be, it was different across each jurisdiction. You do not have to comply until Friday. Basically, the idea is you need to transition because you were already working. So to some extent, through this week, it's going to be a little bit crazy gray area, and I would expect that might be some of the issues. But as of the end of this week, everybody, whether you're working under essential prior or new work, you have to follow it, even though I am saying the recommendation, as well as Greg said, is you need to be following it immediately. So I guess if there's not any other questions, I'll kind of move on here. So basically, the first thing you need to do is have some documentation and some signage, right? You're required to develop and post at each site a comprehensive COVID-19 exposure control plan, mitigation, and recovery plan. Sounds pretty complicated, but BIW has provided a link to some template documents that, to the most part, you can just fill in with your own individual. You guys have all done this for other stuff, stormwater, things along those lines. So it's really similar to that concept. You can just go on there, download it, update it with your information, print it out, and they have to be posted on each of your projects, so each of your sites. And that, again, all these documents and these links and information can be found at biaofclarkcounty.org/phase1. There are about 3 or 4 documents that are required along those lines. One of them is kind of a safety plan. One is part of that safety plan is to recognize where there might be pinch points of things along those lines. I'm sorry, I'm just bringing up something real quick as well. I'm sorry, I was trying to find the signage page. Part of that is just signage about maintaining 6-foot distance. There's a couple other things along those lines. But if you go to the actual page for our page I just mentioned, they have a list of those couple of things that you are required to have there. But like I said, the main issue is your safety plan and the protocol that you are going to follow for safety on site, as well as what you are going to do if someone comes to you and they're not feeling well, or they think they've been exposed and they've been working. And some of those things include the protocol that I'm going to get to, what you're supposed to do in that case. But all that documentation is templates, fill in, print out, have available at your job site. I know some of that signage and things like that are also being provided. Mallory Supply Company, who's on right now with Ski and Mark, they are providing some of those things as more resilient versions of the signage that will stand up, that our weather eyes will stand up to weather. So they will get to that after we get through this real quick. After you have all your plan in place and the signage and the documentation that's required, one of the things you're going to have to work with is you need a site supervisor, COVID-19 site supervisor, someone designated to monitor the health and enforce the safety plan itself, really similar to the other things that you've done, which, stormwater, things along those lines. You guys already have that, so you know how to do this. Just to clarify, if you have if you have 7 or more people on a project, one of the people on site has to be the designated COVID-19 supervisor. If you're 6 or under, you have to have someone on staff, but they don't necessarily have to be on site on that project the whole time the project's going. So that's where the line is for project size. But and you don't have to have a separate person for a site supervisor, right? It could be anybody on your site that you talk to, work with, some of the training that you're required to do, and teach them about this, and make sure they know your emergency and your safety plan and your protocols that are in place. It could be anybody on your site, whoever's general manager. If you have a sub that's on site, that they have someone as part of their crew, right, when they're on site, that obviously qualifies. You definitely want to be sure that have someone on site and not rely on a sub, of course, to make sure that's on site, because you as the GC, if you are, or the site owner, these things are required by the site. When we get into actual PPE, there's another discussion about that, which I can go to. In addition to the training that you have to do up front for all of your members or all your employees, and the subs have to do it, probably easier for you to do it that everybody's coming onto your site for everybody, including subs. You also have to weekly, tailgate safety meetings, stuff like that. Your normal safety meeting, obviously we're following the 6-foot distancing rule, but you need to update them every week, let them know what's going on regarding the protocols, if they've changed and stuff like that. You also need, for part of that process, you'll need to have a process to sign in each person at that and have a record of that to make sure that everybody on site has actually followed that. Once again, safety, social distancing, you know what that is. You must stay 6 feet of separation, every person on the work site at all times. Basically, no gatherings are allowed. One recommendation is that you're going to take lunch breaks, do them in shifts, have your employees go to their cars to have lunch. They just can't gather in the same place at the same time. It's not recommended because it's an easy way to violate that thing. And also in your safety plan, what you're going to do, and you should probably look out for as well, is choke points where people are stuck passing each other. Recognizing the governor and the stakeholder group recognize you're going to be passing people in a hallway or stuff like that. That's just inevitable. So you need to identify those choke points, including the safety plan, and make sure you maintain them, because you don't want some people that's a choke point that someone's working on it. Assume you're in a hallway and someone's working on part of that hallway. Well, people are going to have to find a different route to get around them if they can. But that's kind of where that stands. You can pass people in the hallway. Obviously, it's minimum exposure, but you cannot be working next to each other. And part of the plan is to recognize those. One of the other recommendations, and it's part of the protocol, but it's not listed as mandatory. But for the most part, you should only allow one trade or subcontractor at a time on job site. It's a recommendation. There's some ways you're going to have to work around that, but it's a good way to keep from violating that social distancing rule and some other things along those lines. Now here's where we get to the part that I think most of you guys are interested in, and that's PPE. Everybody on the site is required to have PPE. And a couple of those things are goggles, face covering, hand covering. That's pretty much what you're required. And there's a couple different levels of that. Before we get into the specifics of that, I want to let you know, you are not required to provide PPE for anybody but your employees. So the question's been asked, are you required to provide for a sub? You are not. However, you're responsible for your site. So everybody on site has to have it. So whether you want to provide it and work with your subs as part of their contracting where you're going to charge back to them, or have extras in case some of their people come on site without having it. You're responsible for the job site. So everybody must have all the PPE needed if they're going to work on that site. As we know with other things that Elle and I have enforced in the past, liability rolls uphill with us on these things. They have not said how it's going to work in this or in designation, but we know what the nature has been on everything. Any safety violations or health violations, there's liability that flows up to the general. So good rule of thumb is you need to figure out what your best practices on your job sites to make sure everybody has PPE, whether you supply it or your subs are supplying it. And I guess while we're speaking of that, one thing about PPE, obviously goggles are pretty specific, eye coverage, eye protection. There's all different types in which Mark or Ski can talk about for Mallory Company. Doesn't have to be complicated. It just has to cover the eyes to some extent. So that's great. Gloves, any hand coverings. A lot of, our workers are using gloves just naturally with whatever they do. So they can use those. One question has been asked, well, what if you're using equipment like a saw, a table saw, a saw? You shouldn't wear loose gloves, right? You don't want to get caught in there. That's a safety violation in itself. And so recommendation in that case is for those times when you're working those, use the nitro gloves or something like that. Basically the normal just throwaway disposable gloves that you would use for any sanitary things like those. Non-latex gloves, that kind of stuff for that specific, because if that gets caught or something, it's just going to tear right away. You're not going to get, your hand's not going to get caught in anything. That's a recommendation that we have heard. But besides that, any gloves that are on are fine. The other thing is masks. That's the big question we have. And Mark and Ski can talk to this about the masks that they have at Mallory. We know one of the reasons we've been working with them is they've got a more robust supply chain. I think a lot of you have had some concerns about masks that are hard to find. They are hard to find for everybody right now. And so they have some solutions, but there are some backlogs for them as well that they can talk about. But, they're going to get those to you. And we're also looking at other ways to get those. I can tell you, though, you do not have to wait for masks to start your job. You have to have facial protection, mouth guards of some type, but it doesn't have to be a mask. If you go to that website again that Andrea's put together on our site / phase 1, there's a link to CDC recommendations. They have something as simple as actually wrapping a t-shirt around your face. Would not suggest because it's probably a little bit harder. Or you can cut a t-shirt and make a gaiter. Bandanas wrapped around the face. Any type of face covering. Standard dust masks are okay. You don't need N95 or anything along those lines, unless you're obviously doing work that requires an N95 mask anyways. Any type of face covering basically qualifies for you to get back to work. So I would recommend you obviously figure out a long-term solution if that's working with Mallory or working with your own suppliers to get dust masks, face masks. There are semi-permanent masks. There are masks that are reusable that can be washed. I'd recommend looking into those things. But right now, to get you guys back on site, there are solutions to get you back on site today if you can't source masks in the next day or two or by the end of the week. So I guess that answers, that's kind of where we'd stand for PPE, but I wanted to stop real quick and answer any questions about PPE if you had it, about the protocol to some extent, about sourcing itself. After we finish this little section, Mark and Ski can talk to that. Okay, I do not hear anybody. So the next issue is sanitation and cleanliness. Basically, they're encouraged and required to some extent. Your on-site staff have to have access to a washing station, and it's recommended they wash their hands as much as possible within reason, but they're also required, you need to wash your hands after, if you sneeze, you touch your face or something along those lines, you change protection, you are supposed to wash your hands. You are required to have a washing station. There is some confusion on that. You can have, excuse me, I'm totally blanking on it. Antiseptic or sterilization or disinfectants. You can have those stations, you can have the pumps, stuff like that. People can use that so that way they can clean their hands all the time, but that does not negate the need to have a washing station. It is mandatory to have at least one washing station per project. Whether you have, you source that through your porta potty company that has those washing stations. There are also a lot of versions of do-it-yourself that can be done for under $100 with a pump, basically build a frame, something along those lines. The video that I have at the end of this shows you some of those examples, and there are examples on BIAW as well. I will be posting some examples to our website as well. So there's ways to achieve this without having to make it too complicated, but you are required to have that, even if you have hand sanitizer or other things along those lines. It's recommended to have warm or hot water for that. Obviously, we know the CDC recommendations are. A lot of you are not going to have the capability of doing that. So once again, the wash station's the minimum, can be cold water, basically a pump, foot pump where some people are using, it does qualify, but we would recommend hot or warm water if possible. So I guess the kind of like the final thing to talk about, actually there's two things, they kind of wrap into each other, is basically monitoring. You are required to monitor your workers to some extent. If they're feeling sick, obviously speak to them. You need to let them know on your safety protocols, which this stuff it's all laid out for BIAW, basically what you need to go, what you need to train them on, what to teach them. But if they are sick or showing symptoms, or if they come to you, they need to get off the site now, and you should recommend that they quarantine for 14 days. Obviously, you cannot mandate that, but you should recommend that. BIAW has information that's linked to on our site that gives you kind of what the protocol is if someone comes down with being sick, or if you observe it. If you see someone coughing a lot, shortness of breath, you can make that call and say, hey, I think you probably should, go home. You should probably speak to your physician, and see where this stands before you come back on our site, just to be careful about those things. So the recommendation, obviously, at that point is for 14 days. The recommendation is also, obviously, to talk to their medical provider to see if the medical provider recommends isolation, recommends testing, and things along those lines. So that's kind of a fail-safe for us. We are acting to some extent under the governor's protocols for this as the first line of defense on these things. But that's a recommendation. If someone's coming in and working and you ask them to leave, or they ask themselves to leave, right? They think they need to go home because they might have a sickness. You need to disinfect everywhere they were at, and you need to alert all the people that may have come in contact with them. Obviously, there's some HIPAA issues here, so you need to be careful. You can't name names of people that have been infected or that you're concerned about. You just need to go to everybody that's been in that area and say, hey, we've had some people, we've had some concern, however you want to phrase it, but you can't say, you can't relate it one-to-one with who actually went home or stuff like that. Obviously, people can see what happens on the job site, but you need to be very careful of just saying, hey, we think you may have been exposed, to let them know, just so they're at a heightened sense of knowing that might have happened. It's not to say they have anything or they need to worry about it, and they definitely don't need to go home right now, but you just want them to know about it, so maybe they're a little bit more vigilant when they're checking their temperature. And that basically gets the next point. That's probably the contentious point for us is you need to screen your employees every day. There's a list of questions you need to ask them, and they have to answer no, basically. I think they're all no's. There might be one yes, but you have to answer all no's or whatever to really kind of gauge if they should be on the site or not. Some are as simple as, have you been exposed to someone that has been diagnosed with COVID-19, or someone that has been recommended to isolate? You're supposed to let that. In addition, there's a requirement to take the temperature of every person that's going to be on the site that day. There are a couple ways of doing this. One way Mark or Ski can talk about is thermometers. You can have those. It's kind of standard practice at hospitals now. And basically, it's an infrared thermometer. It's very nice. I mean, you don't have to touch people. You just have to be close to their head. So it minimizes that contact, and it's basically infrared thermometer. What also has been recommended possibly is if you have digital thermometers, you can use those. There are disposable covers. I'm sure you've all used them at the doctor. You can get those. If you have digital thermometers, they're a little harder to get, but you can get those. They're fairly inexpensive. The covers are not running out. You should be able to find those Amazon, anywhere else, Safety to Supply, wherever else like that. I don't know, but Mark or Ski may have some access to those as well they could talk about. There's that. The other thing you can do is, and this is where it's kind of counterintuitive, you can have your employees call in every morning and have someone like on site or at your office, ask them the questions, have them take their temperature then and tell you what the temperature is. Obviously, enforcement on the back end is a little different there, but to some extent, this is designed to keep people aware of. They need to be aware of their health, right? This this is a passive way of saying we need to know what you guys are doing, and remind people that this is an issue. This is not something we're just doing because we want to be doing. So that's another way you can achieve that.
Honey,
having them do
it's
that.
supposed to be in the fridge, I imagine. Is there room yet?
I'm not sure who's actually talking, but someone was talking about a fridge. Anyways, so those are a couple of solutions. Obviously, the infrared is a very good solution. You control that. It's on your site. Your COVID supervisor can take care of that. Mark or Ski can talk about that. Along those lines, one other suggestion regarding either thermometers, digital, or the infrared. If you are considering that, I would suggest you get those sooner rather than later. We're pretty sure that our industry is being used as the guinea pig, the test of this. A lot of the protocols that we are doing will probably be rolled out to other industries as they are allowed to go back to work. It has been done in other states, and the governor has kind of hinted towards this a little bit more specifically in some of the things he's done rather than his press conferences, that we are kind of the model of what they're going to do going forward. So with that understanding, there could be a run on thermometers of whatever type that you're looking for fairly soon when the protocol gets relaxed for others. So I recommend talking to Mark and Ski or others that you have to get those if you intend to do that, because a week or two from now, everything could change. Those might be really hard to get. You don't want to be stuck in that position. Also, if an employee feels that they're not safe, whether they're sick, they think someone else is or something, they are allowed under governor's orders and unemployment and orders and stuff to go home and file for unemployment and things along those lines. It's a little bit more liberal than other states are allowing, but you're required to allow them to go off-site and basically let them do that, and they'll still qualify for unemployment or however you guys want to do it, but they are allowed to do that. It's a decision on your part as well. If someone doesn't feel well or they're a little worried about someone, say you have a one-time sub that comes on and they're coughing a lot, and one of your employees says, I don't feel comfortable being here, and they go home, but they want to come back the next day. You don't have to treat them like they self-diagnosed, right? You can just treat them as they decided they didn't feel comfortable on the site. So that's something to keep in mind when you're going through this. There's a lot of gray area, and I know you're gonna have questions on some of these. There has not been any guidance given along these lines so far from the governor's office. If we hear something from unemployment or L&I, I'll make sure you guys are aware of it, maybe in the webinar next week. But right now, that's just kind of what the overview is. And like I said, the BIAW webinars, the two they've done, which we have links to, get a little bit more in depth on this, but it's still fairly high level. The final thing about safety before we can get to Mark and Ski so they can talk about PPE, because I know that's a big concern from all the emails I've gotten and phone calls. You are required to keep a daily log. Well, first, let me back up. For the thermometer issue or the taking the temperature, you are not required, and I would say you do not want to record that. You just have to ask, they tell it to you, and that's it. If you record it or kept it, you start to run into issues with HIPAA and other laws along those lines. I wouldn't see any value in recording and keeping it anyways, but you are not required to, so please don't unless, I just say please don't. There's no good reason, liability or otherwise, that you'd want to do that. So you're not required to keep that. You're just basically doing a kind of a check, a passive check of everybody before they come on the site. Then that leads us to the last thing is job site visitors. You are required to keep a log if everybody's on the site every day. There is a template offered on BIAW's website for that. I believe Jarrett Helms also provided one to me. I've not reviewed it yet, but I want to get out to you guys. He's included some more of the specifics around it. So it's actually a little more developed. I've kind of reviewed it real quickly, but I'm going to look at that too, and might be able to post that for you guys to take a look at, or something similar to that kind of describes it rather than just being a sign-up page. Kind of describes what you're doing, so whoever your site supervisor is can look at it and know what they're supposed to be doing. Basically, you just take down their name and information, and I can tell you what this is for. Obviously, we got to be safe with HIPAA again. The issue is for contact tracing down the road. If someone is diagnosed with COVID, you can reach out to the others and tell them they've been exposed, or L&I or the Department of Health. To some extent, that protocol has not been designed necessarily. The idea, though, is we need to start tracking that now before when it is in place. We hate to get down 2 weeks, 3 weeks down the road and not have the data that we need. So they're basically, once again, BIEW has more information on this. They've got an example template you can use. There might be some others out there like the one I received from Jarrett, but that's a recommendation, not a recommendation, that is a requirement. You have to do that in everybody on the site. If someone comes on the site midday, you need to have a way to track that. That's basically your supervisor. If you don't have a supervisor on site, you need to make sure that everybody knows to include that, because that's one of the precepts of this whole thing. Basically, that is for the most part everything that you need to know regarding the safety protocols that are required. Like I said, the specifics are on BIEW site, which you can get to we've got an overview, a little bit more of individual links on our site at biaofclarkcounty.org/phase1. That's the easiest way to get to a lot of this stuff. Andrew's done a very good job of making it concise and very forward and direct. There's so much information out there. If you look to BIEW, sometimes it's a little harder to find. So I'd recommend going to our site, because she's got these things specifically broken out so you can find them quickly and easily, and would recommend you view one of the webinars that BIEW's done. Like I said, it goes into a little more in depth, and they're a little bit more specific or unique questions. With that, are there any questions before I hand over to Mark and Ski? Okay, Mark or Ski, whoever would like to start, go ahead and speak to it.
Ryan. All right, thanks very much. Good morning, everyone. Happy to be here. This is Mark Maher with Mallory Safety and Supply. I've got your primary point of contact is on here as well. His name is Ski White, a very nice gentleman that I'm sure many of you have already spoken to or emailed with. We're here to help comply. As Ryan mentioned, and as you have undoubtedly experienced, there is a shortage of just about everything that is on the governor's list of requirements around PPE. The good news is that glasses and gloves are not a problem. Signage for your job sites should not be a problem either. That's a 2 to 3 day turnaround time, so we can get those handled. Right now, and thermometers are in good shape too. In fact, we're working really hard to get the price down on those to a more palatable point, but we will have more of those in next week. As far as masks go, there are a number of solutions out there. You maybe even looked at those, maybe how to YouTube a t-shirt to make a mask with it. I know that a 23-inch by 23-inch square of fabric folded diagonally makes the perfect size bandana, in lieu of the other items that you might prefer, such as the mask that you see here on the screen right now. Those are the ones that we're waiting on coming in. To give you some idea of the volume here is, we just got an update from our sourcing manager. We are 16,000 units in back order right now. We have several options from several suppliers coming in. I do expect that in the next couple of weeks we'll be caught up and have these readily available to you. In the meantime, we might be able to kind of allocate some of the larger orders that are in early, which is what we've been trying to do, so that we can spread out what we do have and share some with everybody. So those folks out there, we have lots of orders for 1,000. We're trying to give them 10% so that they can provide some to their folks, and we can spread around the rest to some others. So we're doing our best to meet the need there.
Hey, Mark, I have a quick question.
Mm-hmm.
So for those masks we're talking to, those are reusable masks though, right? So when like if someone gets 5 of them, I mean, they're reusable masks. So if we don't have a lot walking off the job site, I mean, you don't need to replenish them all the time. So just starting out, building up over time is going to help out, correct?
Yep. They should treat this as any other article of clothing. It is not to be thrown away. They should be using it over and over and over again. The CDC does recommend that you wear this one day at a time, put it in a brown paper bag, and wait for a week. Now, if that's not possible, they can be rinsed out with soap and water, dried overnight. Not a big deal. That will kill the virus. There are a lot of different things that you can do. But yes, this is a reusable product that does meet the governor's requirement. Any other questions that you have, Ryan, or anybody else out there right now? I want to make sure we address whatever you're concerned about.
Yeah, I had a hard time finding that gallon of hand sanitizer on your site. Is there a link that you could send for that?
I don't know if we've got that up on the website yet. Most of these links on the flyer were live when we sent this out, if we had it in stock. The hand sanitizer has been a challenge. We have a bunch arriving tomorrow. And then I just got an email while the meeting was going on that we have 48,000 of the little bottles, 4-ounce bottles of hand sanitizer. Because the challenge right now is we've got the gallon jug there, but we don't have a way to dispense it. And I know that that's a pain for you all. Trying to find bottles and pump tops out there wherever you might be looking is a challenge. It's kind of remarkable how fast all of these things have been sucked out of the supply chain. But if you've been to the grocery store recently, you understand what I'm talking about.
Hey, Mark, one second along those lines. I don't know. I know if you guys, I'm just as off the top of my head, but if any restaurant supply stores, commercial restaurant supply stores are open, that's a standard size top, which you can buy pumps from them. If you're looking for this, if any of our members are looking for this, if there's restaurant supply stores, they may have those in stock, because I'm not sure if people have thought about those, but that's a standard top, and you can get pump tops from restaurant supply stores. So that might be a solution there for anybody that's online right now, if they have those big gallon jugs.
Yes, thanks, Ryan. And I've talked to other people that have been to like Bi-Mart or some of the other kind of wholesalers, overstock wholesalers, and you might find flip top bottles that will dispense. This is a gel, so it's not kind of a spray type cap that you're looking for. It's the pump top like your soap would come out of. So that's what's in this jug. The thermometer that you see there has been really popular. We have moved a bunch of these. It's a digital readout. It's a no touch. You just extend your arm and hold this unit about 2 inches from the forehead, and it gives you an instant reading. And it's very accurate. So, and all you're looking for is an elevated temperature in an employee or sub, and they need to be without a temperature, according to the CDC, to be working. So that's your kind of your early indicator. The other images that we have here of the glasses are everything from just fundamental safety glasses, something a little bit nicer, and then a goggle option if you're so inclined. Then Ryan, if you scroll down, there's more information below the fold, and this would be social distancing signage. We included a few, a couple traffic control devices here. That's something that we've seen to eliminate choke points. Is maybe you have a walking path on your job site. If you're coming in, you go one way. If you go out, you go another, so people don't have to brush shoulders coming and going. That's just one idea that we've heard out there. I know it's going to be a challenge when you guys are working inside of a home or a building to maintain that 6 foot social distance, but that's the idea and the goal, is to maintain distance and not share breathing space with another person. And then just some of the generic things here. You might need fall protection, first aid, danger tape, caution tape, hydration products. We're a full line distributor of all of these things. If there's anything that we can do to help you be more successful on your job and save some costs, cutting one PO with one supplier is a lot more economical than running around town trying to find all of these things. So we'll do our best to help you.
Mark and Ryan, one question for you for the signage. I understand all the documents that are required to be on site and sign-in logs, et cetera, because I got those off of your website. But are any of the social distancing more permanent signs, substantial signs, or is there any signage that is required at this point that couldn't be printed in the flyer form?
I can answer that. There is not. It was designed to be printed as however you want to print it. The one concern that we obviously have, and that's a solution that Mark it could provide, and some others is, on a job site, if it's a hand printed, if it's a printed, it's going to break down. I know a lot of people put them in plastic and stuff like that. So, there's no requirement to have like a formal sign. They have no design requirements. They don't have sizing on them that's required. That protocol document is the full document. There's not underlying ordinance or regulations, definitely not statute under that. So that is the document you're supposed to follow through. So there's nothing beyond that for requirements. So if that answers your question.
Yes, it does. Thank you. Great.
Are there any other questions for Mark or Ski? Okay. Well, just to give everybody else a heads up, at the end of this, they're available. The last two webinars is a little document I put together that includes all this information. Basically, it's a living document, so I just add the new webinar on it, so it's getting longer, but it has all the information for you. So that will provide this information that Mark provided as well. I've gotten quite a few emails on it, so I've responded with their contact information as well as this document. So Mark and Ski, if you want to stick around, you're more than welcome to. Basically, I was just going to answer some questions I've received right now. And then point people towards the video. We're getting towards the end of our time. The video is about almost half an hour long or 20 minutes long, so there's not really time for that. So if anybody wants to watch it, I will include the link for that. And actually some of the questions I've received are actually answered in that. But one of the questions I received today is kind of what are the fines, or what's the enforcement? I will include that in this document as well. But basically, the first time enforcement, the governor was adamant and reiterated in his press conference what the enforcement was. He had started it, I think, 2 weeks ago when he clarified what enforcement was. But the first enforcement is basically asking you to stop and telling you to get off the site if you're not complying. That was, if you're not supposed to be working. Now that you can be working under essential, it will be if you're not following the rules, they're going to tell you to fix the rules immediately, and you cannot be on the site until you fix whatever you're breaking. As I mentioned up front, you need to comply 100% with the rules. This is not piecemeal, piece by piece. We know you can't always 100% comply. That's just not the nature of anything we do. But the fact is, if you're not complying with any part of it, and L&I comes on site, they can have you leave until you get it corrected. So there's kind of that part of it. After that is, after asking you to correct it, they can ask you to leave until it's corrected. That can escalate, obviously. The next step is if you keep, working without the proper documents, signage, or following the proper protocol, or if anybody on the site is not following. Once again, it's not your responsibility for some of these things, it's the sub's responsibility, but you're ultimately responsible for the site. The site is yours. Individual workers belong to their company for responsibility. But the next step is basically what they can do is they can start pulling permits, whether it's, it's your building permit or whatever you're working on, that they have the ability, whatever jurisdiction could just, basically negate your permit. They can ask you to fix whatever you're doing, and they can negate or pull your permit. After that is you get into the higher level, which is, this is going to be pretty egregious, but that's when law enforcement gets involved. What that is the highest level. There could be some lower things. We don't know what they are. I mean, that would fall under each jurisdiction, how they want to enforce as their individual law. But under the governor's order, if they were going to enforce that, like for Clark County, the sheriff, basically that can be a gross misdemeanor. A gross misdemeanor is basically that's a pretty high violation. It holds up to a year in jail and a $5,000 fine. And, it's not a ticket anymore at that point. That is, you're going to go to court for that. And you as an individual are held liable. Obviously, if you have, jail time, associated with it, you're held liable. Nobody can, it's jailable, it's a jail time. Gross misdemeanor kind of falls under the same jurisdiction as felonies. So that can't come from permitting organizations. It can't come from the jurisdiction. The only person that can issue that is an officer of the peace, which would be sheriff's office or police department. So a sworn officer of the peace is the only one that can issue that violation, but it's a big one. If any of you got to that level, which I don't think any of our members would, there probably possibly could people that do not participate in our association that might push the envelope. Get to that level. Not only are you going to have that problem, which is a huge problem, it can basically hurt you for long term with any getting permits and stuff along those lines. Obviously, also liability, your insurance, all that stuff. The PR backlash would be very big. That would be in the news, and that would be the blowback on that would be very substantial, possibly enough to get the governor to reverse his decision if just that happened a couple times. So that's where the level where the hierarchy of enforcement goes. I have another question. As a subcontractor, who is responsible to post signage? To be specific, I've kind of generally spoken to that. That is whoever is the site, whoever owns the site per se, right? The general contractor, whoever that case is. They're responsible for the site. They have to make sure everything is happening on the site to qualify for to work, right? To maintain that protocol. And so they would be responsible for that, to make sure that's there. Yeah, so that's a simple question. You know, they maintain the site, individual companies maintain their members or their employees. I've had a couple other questions specifically to remodeling, and I would definitely direct you guys to the video that BIAW did from on Saturday. Joseph Irons from Irons Brothers Construction gave a presentation. There's a slide deck that's included about what he's been doing. He's qualified for some projects as essential. So they've been working for the last month, and they put these protocols in place right up front. And there's one section specific to how do you work in an inhabited home. So I'd recommend reviewing that. But generally, this video and slide deck goes over a lot of things we've discussed today. There are examples of homemade or site-made washing stations that they've done. Usually there's a couple, be simple as a bucket and some other things like that, but there's some solutions where they've gone to their local supply store, their, even Home Depot, and work with people like Mark and his company to get like foot pumps or whatever the case may be, different parts, and put it together to take care of that. So there's examples of that. There's examples of what they do for their protocol, which is some of it's wayfinding, right? Like Mark suggested, of how you get around a site, what they're doing to protect their employees, just generally as their best practice as this. That's not necessarily required, but will help emphasize and make it easier to follow the directions of the guidelines. And specifically for, they've got 2 or 3 examples of remodelers, or when you're working within a house, right? One of the things they do, if they can, they put up, they basically cover off a whole wall, and they tape it all off and everything else. And so that way you don't have to worry about it. Under this protocol, if you're in a house that's occupied and you're a remodeler, you basically have to make sure they stay 6 feet away from you. Actually, it's less than that. I believe more than that. They have to stay 10, if you're in an occupied house, everybody has to stay 10 feet away from each other, including your employees have to be. So it makes it really difficult in a small space. To get around that and get back to the 6 foot distancing, you have to basically create your own site, right? So what Joseph did was, at his sites, if possible, they are blocking off. If you're working in the kitchen and there's like, an open entry into the living room, they do a full, protected visqueen block off between the two. And then they have some different things like a little flap where you can actually, if you need to talk to the homeowner and stuff like that. But they basically isolate, like you would if you're doing, any work, concrete work or anything else with dust. Anything you do for dust mitigation, basically that's what they're creating on every single site that it's possible. So that way they fall under an individual site rather than an inhabited house. If it's inhabited, it gets a lot more difficult, that everybody has to abide by that 10-foot rule, which inside a house would make it very difficult to do that. But like I said, I would recommend everybody watch that video. I believe it's the 86-minute mark of the longer hour-and-a-half video. That will be on the site. I believe Andrea has it up. If not, we will have it up immediately after this. It will be included in the wrap-up document. So that way you guys have that. But it was very informative, and it answers a lot of the questions I've received over the last couple of days of how do you do this, how do we do this on site. He's had a month to put this together and work on it and work out the kinks. So it's very, very helpful. I've got another question, which thank you, Garen, for reminding me. I asked you to remind me about this, and I appreciate it because I would have forgotten. Brian, what is considered a site? If the project has 5 homes or 3 subs in each home, is that required to have a supervisor? Basically, this is somewhat of a gray area, but I know Greg Lane had said for a site is each project, right? So a house is a site. Each site will have to have its own washing station. He did not, I haven't heard anything from him in this answer about if they have to have individual site supervisors for each site. The understanding is probably not. If you have someone 3 houses next to each other, four houses next to each other, that puts the number at, like, you know, you're looking at 15 people, right? You need 1 supervisor. It could be 1 person across those sites. I have to be honest, that has not been qualified anywhere, but from what my understanding from Greg is you could have 1 supervisor. That does not mitigate the need to treat each house separately for required signage and hand cleaning and stuff like this. Did that, Garen, I know you're on right now. Did that answer your question? I know it's a little vague, but that's kind of the info I have.
Yeah, I think so. I think how I interpreted what you said is each permit would be a site. And so if you've got 6 people working under that permit, that would be one site. However, if you've got 2 sites, 2 permits next to each other, each is required to have their own log, their own signage, their own wash station.
Actually, that's a very good point, Garen. And I would say, obviously, you know, this is not legal advice, as we always say. This is just suggestions and some guidelines, but that would be a very good marker to use for what you need for these requirements. And I can tell you one reason why. Basically, the question I was about to get to after this was what's existing. I've had that, and this ties right into that, Garen. You're following along the lines of deciding what's an existing project. And the governor has been very clear with, well, not very clear, has been somewhat clear, but has kind of stated that what is an existing project is being left up to the individual jurisdictions. Kind of the common practice so far is an existing project is anything that's has a permit associated with it, right? If you got a permit okayed, or it depends. Some are looking at if you have an application in for a permit, that's an existing project. Some are going, if you have a permit that's approved, that's an existing project. This is generally, right? This is not specific to our jurisdictions because I've not heard from them yet, but almost every version of existing is predicated on some type of permit. So if we're going to predicate the ability to work on existing projects by permit, I would say that's a very good assumption that you can figure out compliance by permit. So I would say you're definitely going down the same road. The other issue is here along the lines of that question and others. You know, if there's a complaint or something comes, you know, the sheriff's office or the local jurisdiction police department is going to come by and say, talk to you, right? And there's a conversation there. It's not going to be shut you down, I don't expect, especially in something like this. There might be a discussion, but I would say you're probably fairly well informed if you go by that designation.
Thanks, Ryan.
Okay, I have another question. Okay, yeah. Someone brought up that Greg mentioned that the regulations apply even if one person's on a job site. Yes. Basically, a job site's a job site. If you're under, you know, under 6 or under, you don't have to have an on-site supervisor per se, but you have to have one for your projects. So there has to be, you have to have someone. If you have a team of 6, that's your whole company. And that's all that's going to be on the site. You have to have a supervisor, so naturally they're going to be on the site. Even if you have 1 person, you have to have a site supervisor. So that's how that works. Yeah, every site, basically this is done by site, not by company size. Your sites are somewhat, as Garen pointed out, and kind of how we're working the designation is essential. Each site is kind of what the deciding factor is to some extent on some of these things. So yeah, if you have 1 person, 2 people sites, if you're a home builder, obviously, if you're working on your own project, there was a knockout in the original proclamation emergency order that you don't have to follow, you're essential, right? You don't have to follow the essential rules. Well, if you have anybody on site that's a sub, anybody doing any work, you're automatically a site. So if you have a home, and I know this for someone asked this question, if you have a homeowner that's doing all they're acting as their own GC, they're doing almost even all their work except some finishing work, for example. Once you have anybody else coming on the site, that is a site for this, and you have to follow all the protocols, whether it's having site. You have to have people logged in. You got to do the temperature and everything else, and that's going to follow to the homeowner if they're acting as the GC. Are there any other questions? We've hit the hour mark. We're scheduled to go to 11 if need be, but I just want to see if there's any other questions out there. Feel free to shout it out, or you can send a text real quick as well if you'd rather do that.
Ryan, what do you think the timing is on phase 2 being implemented?
Thank you for asking that question. And yeah, there is no timing on that, and there will not be. I'm not going to say, well, we will eventually know what the timing is. There's not timing. The governor has very specifically stated what his protocol for that is. The protocol is when they feel comfortable by the statistics, which is going to be how many people are infected, how many new infections, how many deaths, as well as he's been fairly clear on any more relaxing of the rules, whether it's for the general public or our industry. He's been fairly clear that the big thing he's looking for is enough testing to be happening that we can feel confident that the numbers are informed of what they're having for how many people are infected. So he said multiple times, his kind of metric now is we have to have enough testing. So they have to have enough test kits being processed each day. So I think that is where we're going in. So I can't give a definite date or even a rough date. What I can say is it's a trend, right? If you see that number going up, as well as the number of infections or deaths going down, there's going to be a crossover point. I can't tell you what that is. I don't think the governor stated what his number of daily tests are. I know other states have, but I'm pretty sure that's the metric they're going off of. So that's kind of where we sit on that. I don't expect a date certain on phase 2 from what the governor said multiple times. I could be wrong. He kind of surprised. It didn't surprise us. There's a lot of effort going into this effort, but basically the day of, there wasn't much lead time for our industry or others, or even local jurisdictions on this decision, even though we knew it was coming. So I think that's the best answer I can give you on that. I can tell you phase 2 is being worked on right now. Greg Lane, our other staff at BIW are working on that. They're working with the other organizations that make up the stakeholder group, including some trade unions, some other building associations similar to ours for commercial along those lines, and some other skilled trade unions as well as larger labor unions. So they are working on it right now. What we envision, according to what Greg has said and some stuff he's put out there, is the next level would be basically all the same protocols we currently have, but it would open it up to all construction. It wouldn't have to be pre-existing or anything along those lines. We do not know if that will include. There's some thought. We do not know if that will include allowing work that doesn't maintain the 6-foot distance. That's where the gray area discussions are going to happen. I believe the intent of Greg and his staff is to push for that. So it's not only allowing new construction to start, but it's also allowing, some leeway on the 6-foot rule, maybe staying with the 6-foot rule with the understanding is if you need to move something, granite slab or a countertop in or something, you can, and it's, shorter than 6 feet, you can take care of those things and not have to 100% comply, even though comply 90% of the time. But that's where that stands. I have not seen anything about the documentation for that or even what that will look like. I'm not even sure if they drafted anything on phase 2. They were focused so much on phase 1 to get it out. That's kind of where it sits. And the other fact is I don't believe the governor made a commitment until he made a commitment by announcing it, or a few hours before or a day before announcing it. So I think the stakeholders weren't moving forward until they knew the first phase was adopted. So that's why they're just starting that now.
Makes sense.
If there are any other questions, I would love to answer them. And if there's not, I will send out a document to everybody that's attended today with basically, it's a roundup of this webinar with the appropriate links, kind of a show notes. I just appended it to the beginning of the webinar, or the notes from the last 2 in case you want to see those and you weren't able to. It also includes links to the past webinars in case you want to view those as well. Last week we talked about similarly a little bit more on PPE based on what we thought was going to happen prior to the governor's order, and the week before that was just kind of generally about what was going on. We saw the jurisdictions. I can tell you the first week a webinar was specifically mostly about local jurisdictions and what they were doing under the current order. I wouldn't say that's as helpful now specifically on what's going on, It will give you an idea of how the jurisdictions were operating and how friendly and how liberal they were in their interpretations compared to others. And that may give you an idea moving forward of how they're going to react to some of the stuff we're doing now. But per se, for specifics, most of that stuff is somewhat moot now.
Ryan, I do have one question.
Yes, sir.
Is Battleground the only one who has explicitly said that, taken this liberal interpretation of existing projects, which basically allows new single families to move forward because if they were in a subdivision?
Yes, Battleground is the only one. I know there's efforts in other jurisdictions outside of me. There's a couple, I know people, a couple of companies have sent letters. I've got a copy of some draft language. I'm going to reach out to them. That's unique. Talking with my other government affairs directors, that's more liberal than they've even been asking for, because they've been giving a couple different options. They're both fairly liberal compared to how it could be interpreted, right? Basically, it's if you're in the approval process, if you got an application in for anything. But it's application in for a project rather than platting and stuff like that. I am waiting till I hear back from our different jurisdictions I'm speaking with to kind of get the lay of the land before we know how far to push, right? I kind of need to know where they stand before I send that out there for a request. Like I said, I have a meeting with Ridgefield today. I think I have another one today with another jurisdiction. Obviously, Battleground, you referenced, that's on their website. Canvas has been very, very specific. I think they've described what existing is. It's still a little gray, but it's basically if you've started something, right? It doesn't go to the level of, if it's platted, you can go forward. It's basically if you have a permit been issued, specifically to the actual building, to the actual project, right? It's project-specific permit rather than a, development permit. So they said that's on the website as well. I'm waiting to hear back from Washougal, Vancouver, and Clark County. La Center, I believe. I haven't heard from them, but what they've been doing pretty regularly is following Battlefield and Ridgefield very closely behind. I know their person at La Center actually came from Ridgefield, so he's been very good to work with, kind of like Steve has, and the people at Battleground. So I would expect that. I know that Ridgefield was formalizing what they wanted to do yesterday. I know Steve was working on that with Claire, the interim comm dev director, and that's my meeting with her today to see where that kind of shook out. And I'm going to let everybody know what that is once we hear from that. I can tell you from the past experiences, Steve has been our advocate. He's worked very closely with us. He used a little bit of legal nuance to get us back to work quicker and more expansively than others have. So I imagine it'll be a fairly workable solution coming from Ridgefield, but I haven't seen it yet.
Thanks, Ryan.
Okay, well, if I don't have any other questions, thank you so much, everybody, for joining us. Like I said, I will get this document out. But at a minimum, please, if you have any questions, obviously email me or give me a call. I would love to answer them. There's so much nuance here. It's usually easier to answer in an email because I can link you to all the different points that you need to talk about. But I mean, phone calls are great too because then we can discuss it. I can send you stuff right then. As always, I would recommend going to the BIA, our website. BIAW is a great resource. They've got a lot of stuff going out there, and some of it's very top level just due to the fact that it's statewide. Andrea has done a phenomenal job of creating a couple different pages on our site. One is the COVID-19 page, which kind of encapsulate everything, and there's little sections she's broken out that point to individual bundles of information. I recommend going there. It's in the upper right-hand corner of our site. There's a link to it. You can go straight there. That links to a lot of these other sites. Also, if you go to /phase1, it has everything we kind of discussed today in a much simpler form, and it's got a link to the BIAW webinars as well as the documentation and signage you need and the recommendations. It also includes a link to the CDC recommendations and other things about how to create your own face protection, breathing protection until we can get all those masks in place that you needed. Actually, and one question, I want to say one more thing. I've heard from someone in our chat as well that they actually went and got traditional thermometers with disposable covers, and they went to their local medical supply. I don't know. I haven't talked to Mark at Mallory. I'm not sure if he's still on. If they offer that, I wouldn't doubt that they do. They all have a lot of solutions for safety. They do pretty much everything. But if they did not, or there's a concern there, it sounds like some medical supplies might be a good choice for you as well. Well, thank you, everyone. I really appreciate it today. I'm going to get on this document so I get the show notes out to you. Like I said, if you have any questions, feel free to give me a call. It'll be listed on that, or you can call the office, and Justin there in our office will forward it directly to me. Thank you.
Thanks, Ryan.